Good afternoon and welcome to the Columbus Metropolitan Club and welcome to our in-house audience. It's good to see you again. I'm Steve Marks, Chair of the CMC Board of Trustees and President of Hannah News Service here in Columbus. Metro Club live streaming is presented by the Emergency Response Fund of the Columbus Foundation in partnership with the Columbus Dispatch and PNC. Thank you. We'd also like to thank those of you who purchased a virtual seat for today's forum. We are very grateful for your support. Largely because of you, we are able to continue live streaming. You can learn more about CMC, register for events, join or renew your membership, purchase a virtual seat, or make a donation anytime at columbusmetroclub.org. Today's forum is sponsored by the Crane Group, Grain Insurance, and the Columbus Foundation. Won't you please help me thank them? Now let's welcome Dan Sharp, Vice President for Community Research and Grants Management at the Columbus Foundation, to introduce our forum. Dan?
Thank you, Steve. The Columbus Foundation is pleased to support the mission of the Columbus Metropolitan Club to engage the community in meaningful conversation. And each year, CMC brings a special forum focused on nonprofit sector, the challenges and the opportunities, called the State of the Nonprofits. And today, we have a special focus on the human service sector of the nonprofit field. The world feels very heavy, distinctly heavy, but the work of the entire nonprofit sector feels distinctly important and urgent for each and all of us and for humanity. And so today, I'm looking forward to hearing from some of our community's leaders and helpers by way of CEO of Alvis, Denise Robinson, CEO of Southside Early Learning, Colin McGinnis, President of Physicians CareConnection, Ikharebha Green, and moderated by our host, Executive Director of the Human Service Chamber for Franklin County, Mr. Michael Corey. The stage is yours, sir.
Thank you, Dan. Thank you, CMC, for hosting us. This is the first time I've worn a suit in 14 months. I had to squeeze into it this morning, so forgive me if I look uncomfortable, that is why. This is a challenging day after a challenging 14 months. And I'm grateful to 3 of my friends and 3 of my bosses for being here today to share about the state of nonprofits in our community, but also the state of our community. And we will do our best to engage and enlighten as best we can, acknowledging the grief and the emotion and the hurt that is out there for so many right now. As Dan said, I am Michael Corey. I'm the Executive Director of the Human Service Chamber, which is essentially a chamber of commerce for a little over 110 health and human services nonprofits in the Columbus region. And our job is to, and has been, especially over the last 14 months, serve as a support to our helpers, however we can be of support. But I am grateful to tell you that so many in this community have found ways to be of support to our agencies through these past 14 months. And I didn't want to dive into this without acknowledging all of the different partners that have become partners and that have been partners over the last 14 months to help our community get through what we're still going through. From CODA, which has donated enormous numbers of bus passes and masks to our member agencies to help people get to and from vaccines, to our government agencies, which have prioritized federal dollars to ensure agencies can keep providing services, to our universities, which have found clever ways to open up the expertise of their professors and institutions to support our sector. There have been so many efforts to keep these agencies in a position to help. And we're going to talk about where we are and where we're going as much as we can today. I want to offer special thanks to Tasha Booker-Fowler, who is also one of our bosses at City Year Columbus, and who's actually changing role. She got a promotion within City Year and will be going to City Year National in June, which I'm very sad about, but very excited about for her. She was instrumental in putting this event together today, along with the team at CMC and our 3 distinguished panelists today. So let's talk briefly about the state of the sector with some basic data. We have been conducting regular surveys of our membership, along with the United Way and Illuminology over the course of the last 14 months. And we've also been doing internal surveys either weekly or every month of our membership to try and keep a pace with the enormous change and enormous challenge that the breadth of the health and human services sector has faced. The most recent data I can share with you was from an internal survey we did in February. $75 million in revenue losses due to COVID alone since March of 2020, and $25 million in incurred costs due to COVID since March of 2020. That's just from 68 agencies. Those numbers are bigger, and those numbers are very old because they're from February of this year. We're putting in the water this week another survey with Illuminology, United Way, and we'll have more data to share with you soon about the state of the sector from that perspective. But we're going to really hear about the state of the sector today when we hear the stories and the perspectives, that proximate information that these 3 incredible CEOs are going to share with us. To start with, I want to, of course, allow for each of our leaders to share a little bit about themselves and their organizations, but being cognizant of one of the unique challenges on the sector this past year, and especially the last 24 hours, it's been mental health for their workforce, for their team, and not just for their clients, and for themselves. And I would like to invite each of you, starting with Denise, please, to share a little bit about your agency, but also to tell us how you and your team are doing, whatever you're willing to share, and how we as a community can be of support to our helpers on the front line through this continuingly difficult stretch.
Thank
Denise.
you. Thank you, Michael. It's really interesting that you talk about us, but we should really talk about Michael Corey. He has been amazing. He says we're his bosses, but really, I don't look at that. I look at it as a great partnership and relationship, and he's been amazing for the chamber. So I have to first start with saying that. Secondly, again, I'm Denise Robinson. I'm the CEO of Alvis. Some of you know me as know Alvis as Alvis House, but we dropped House about 7 years ago because we're much bigger than that. We've been in business since 1967, and we've been turning lives around since 1967. We have a budget of $35 million. Most people don't realize that because they thought we were a house. It's a $35 million budget, and we have over 500 staff. And we're actually just not in Columbus. We're in Chillicothe, Dayton, and Toledo, and Lima. So I just wanted to point that out too. But our organization serves individuals that have been involved in the criminal justice system. That's number one. We have 5 lines of services. Number 2 is working with individuals that are in need of substance abuse, trauma, and mental health. And then we also work with families and children that their parents have been involved in the criminal justice system. And we also have a large behavioral health treatment that we provide too. Our final line of service is working with individuals with intellectual and developmental disabilities. We have those in 22 locations around the state. So we're kind of spread out, but we're one family. I always say we're one family. Always look at our population as the most underserved in our community, the ones that people don't want to talk about or discard. People want to discard them. You know, I've even been asked, what do you call your clients? Do you call them ex-offenders, former offenders? What do you call them? And my response is always, people. Let's try that. Let's try that, because I'm sure everyone in this room knows someone that's been involved in the criminal justice system or has an addiction, and the addictions are really prevalent right now. So I will get to the question, Michael, I'm sorry, but you talked about mental health. although our organization provides a lot of mental health for our staff, for our clients, our moms, our kids, our dads, but also right now, it's our staff that need it. And I talked to Michael about 7 o'clock this morning because I was having a really hard time today just thinking about our staff. Our staff have been tremendous. We are a 24-hour-a-day operation, and people have to come to work. There's no way that we can do our business without coming to work. And they have been strong, they have been present, they have been giving and loving to our clients and making sure their needs are being met. So I really could spend a long time talking about the mental health needs of our organization, and we've done some very unique things to provide for that. And I also want to thank the Ohio State University because they did that pilot through the Human Service Chamber to allow for our staff to contact folks that had graduated from the social work, School of Social Work, and they're all over the world. And it's been funny because of our virtual world, we've been able to really participate in that program. But I won't belabor because I know we have 2 other people. But mental health is an issue that we're all being faced with, and we really, really need to do some deep dive into how we're going to fix this.
So good afternoon. It's very weird to be with people that are not under 5, so bear with me a little bit. My name's Colin McGinnis. I am the CEO of Southside Early Learning. If we're going back 7 years, I guess Southside recently changed its name. We were Southside Learning and Development Center before, but we've been around since 1922. Actually, the oldest organization, I think, up on the stage today. We're probably the one you've heard least about, unless you're kind of in the early childhood space. Columbus has done a really good job keeping early childhood and nonprofits kind of separate, not in the community aspect, but infrastructurally, system-wide government. That's kind of how things work. But we're so much more than the now, 13 classrooms that we have. So flagship at the Reeb Avenue Center. Through the course of the pandemic, we've been stepping in and helping out, expanded into the Hilltop and into the West Side, growing our 8-classroom operation that was serving roughly 100 to an organization that's now serving 170, with a 4-year projection of serving 500 of our youngest neighbors, which we're really excited about. But that is not, I think, the work that is propelling Southside the most. So our classroom programs are great, but we're spending a lot of time in the early childhood workforce, going to the mental health component, which I'll talk about in a second, but a sector that really needs some love and really deserves recognition for the amazing work that we do. Doing some professional development, and then also launching out a whole line of research and innovation for an industry that really hasn't been innovated since the 1960s, 1970s, when Head Start came online at the federal level. Our work at Southside also has a really heavy family component. It's a core of what we do. Integrated family engagement is part of our work. And wow, did I know that was important, but not until the global pandemic rips through your community do you realize how much support is needed and is provided to the families that we serve, usually in the classrooms, but extended through our family center. I would say the pandemic has provided us for the first time the opportunity to really reflect on what our staff needs are. I never thought that I was going to have to help a staff member navigate eviction. It's super embarrassing to say, honestly, the fact that in early childhood, wages are less than $10.50 an hour, and we're entrusting them with our youngest residents and with the future of Columbus. You add a global pandemic, you add that we were on the front lines every day, 6 a.m. to 6 p.m., aside from, I think it was about 55 days for the entire year. The staff's worn out, they're tired, they need resources, and honestly, we're running out of the where to turn because cash is strapped and resources are few and far between. So I'm really excited to talk today about kind of where we've been, and then also what do we look towards as both an agency and a community.
Good afternoon. My name is E.C. Ikharebha Green. I have had the absolute pleasure to lead Physicians CareConnection for the last 18 years. In true fashion, as the previous 2 colleagues have established, we have also evolved. Many of you know us from our free clinic, Physicians Free Clinic, that got its start in 1993 We are an affiliate of the Columbus Medical Association, and so that free clinic was an altruistic effort from our physicians to give back to the community to serve a population who did not have access to health care. Since that time, that model has allowed us to really evaluate and look at-risk individuals and families. Many of their needs, while they need access to medical care, really result from their social and community conditions. And so while I can find a physician who's willing to help me treat an individual that may have diabetes, if that person's electricity is cut off, they can't store their insulin, or if their child doesn't have child care and they need to make an appointment and they don't have anyone to take care of their child, they may miss that appointment. Or if they lack access to reliable transportation, that also causes problems in them accessing not only their care, but in trying to deal with other day-to-day things that exist for them. So in addition to the free clinic that still operates in partnership out of the Columbus Public Health Department, we also operate Step 1 for a Healthy Pregnancy. That initiative is in alignment under Celebrate One, and it is our effort in this community to address infant mortality. So what we are doing is working with women. We want to make sure that they have early access to care, as we know that that can lead to healthy pregnancies. In that, we're also coordinating access to prenatal care and other resources. I know when the pandemic hit, immediately, our moms needed diapers, formula, and so we were trying to figure out ways that even though we could not do face-to-face visits, we were doing drop-offs to their homes. So we have 25 staff. Some of them are part-time at the clinic. I probably have about 18 full-time staff that are working in the office day-to-day. A portion of those staff, we're using what is called the Pathways and Community Hub model, which is an evidence-based model to help reduce risk for individuals as they're trying to address their social and medical needs. So my staff, they are community health workers. They're people of the community, and sometimes, many a times, they're standing in the same lines of the people that they're trying to assist. So when I talk about, or when we talk about the mental health needs for my staff, even before the pandemic existed, we were dealing with some of these community issues and conditions that they deal with daily. Like my two colleagues have mentioned, my staff have been phenomenal. During the pandemic, half of my staff came down with COVID. We closed not one day. We continued to serve. We bound together. It was ugly in the background, but to the patients and to our clients that we were serving, we had continuous care and service. So we have also learned a lot. Their moms, their dads, you know, so at-home schooling for all of us was like, oh my gosh. So how do I do that and try to serve the individuals that we're serving? So from a workforce perspective and looking at some of our work from home policies, those are some of the things that we had to look at and address, because when you talk about mental health, you talk about stress. And so whatever way as a leader or as an employer that I could figure out to relieve their stress, whether it was working from home a couple of days and then coming into the office or switching out. We did everything to try to be flexible in order to meet the needs of our staff, because they're really the superstars. I know that as a leader, we get a lot of acknowledgement, but it's really my staff. They're the superstars. They're the ones that are out there every day, day to day, working with folks and trying to figure out answers and not taking no for an answer. I know we'll get into some more things about the state of nonprofits, but it's really important to understand that we have to individualize the care that we have for folks. One size no longer works. It never worked to begin with. And the pandemic just really exacerbated what that looks like. And so, from a quality standpoint, helping, 5,000 and 6,000 people is very wonderful. But, if I can help 20 people stabilize themselves, that also has value as well.
You can see why I'm so lucky to work for people like these three, and why we're so lucky as a community to have leaders like this. let's jump into the meaty question of assessing the state of nonprofits. You have seen the many pivots and pieces of agility you've all had to employ running your agencies through the last 14 months of one crisis compounding on another. And as we all know, all of the issues that have been exposed and exacerbated have been in place for a very long time, including the stresses on nonprofits and nonprofit staff and the people that they're serving. We're at this moment now, though, where significant funds are going to be coming into our community through the American Rescue Plan, not only to our local government and to agencies, but directly to people in need. We're at this stage of the pandemic where we're working with health officials, and I should thank all of our health officials who have been extraordinary partners through the past year. We're meeting with them at 2 p.m. in our membership to talk about how we can vaccinate our community better. All these efforts are afoot, but we're not quite there to whatever the next piece of this is. How would you assess the state of your nonprofit today, as well as the state of the health and human services sector right now, knowing that you understand your agency better than anybody else, but you also work with and understand the breadth of that sector better than anybody too? Isi, if we could please start with you.
I would say during the pandemic, in the beginning, what I was really happy about was that there were agencies that came together to try to figure out how we could work through some of these things together. So one of the examples I'll give is really around housing. So we've had monies that have come through the Coronavirus Act into our community. It went into what you guys probably maybe or know about is the Impact Hope Fund. And around that effort, there were several agencies that came together to say, we don't want to be a barrier to the clients that we're serving with all of our rules and guidelines and how individuals access these funds. How is it that we can work together to develop a process where we're assisting people to get these funds and get them quicker? And while we have been working together to help expedite those applications, working with the landlords, working with the tenants, we also know that in this community, even before the pandemic was happening, housing instability is an issue, and it's going to continue to be an issue. So while we're dealing with their immediate crisis, it's nice to have those organizations together to start talking about what do we do after, because we know that the effects of what has happened with the pandemic will continue to impact our community for years to come. So what I would like to say is that I have seen nonprofit organizations really do what they've done before, but now we're receiving recognition for it, which is be flexible. Be flexible on how we're able to serve, and I really appreciate us not trying to go outside of our scopes. A lot of times what happens is you're trying to do so many things and then you start doing what other people are doing and you're duplicating services. I feel like I saw a real effort to really figure out who the players were in the field and then how can we work together. I talked to Colin. I met Colin a couple of weeks ago, and it was because we were trying to understand how can both of our organizations work together to meet the needs of people that we are commonly working with.
So if you've ever had the chance to interact with me, you know I can't think in a shorter amount of time than 5 years. So while I know, Michael, you probably want the conversation to reflect back, that's not how I function or how I work, so I apologize. I will be the future-oriented voice probably the entire time. But if you now, as an individual, a community member, a funder, are sitting here and waiting for things to go back to the way they were, I regret to inform you that the organizations that are going to try to do that are going to fail, and organizations like the ones on the panel today are going to be waiting for you to come back and let us know how you can help. Because what we learned through the pandemic is the system and the model is broken. And I'll speak only from nonprofit childcare for an example. I'm not a nonprofit for some funding sources, and I'm not education. Where am I supposed to get money from to make this work go? There's, from funders, legacy funders that have been with us forever, we've seen 60 to 70% cuts and reductions because the funding models have changed. And what we saw at Southside is and it might make some folks angry, but there is now a difference between a funder and a partner. A funder is going to sustain our work, and they're going to bring us up to where we need to be, and they're going to make it go. The partner, though, is going to say, you know what, you're doing something different. I trust you to be the expert in nonprofit childcare. I trust you to be the expert in early childhood education. I'm going to take a gamble. I'm going to let you innovate, and I'm going to see what is that return on my dollar in terms of social impact. If you're not willing to think like that, you have to think differently just as much as we are, because everything that we've seen through COVID isn't new. Any of us up here could tell you that. It's not fun anymore to run an organization with 5 admin. It's tiring. We're exhausted, right? It's not fun anymore to try to get the lowest amount of compensation you can provide to a staff member because you're trying to get someone in cheap. We need good people. We need good people fast, and we need people who are willing to pivot. And I hope I'm not speaking out of line for either of my colleagues up here, but the reality is, like, we all as a community need to understand and reflect on that. And it works for organizations that are trying that. Southside had a great year. I feel bad sometimes in conversations like this. We had a 529% year over year. Like, that's a big deal. But it's because we thought different fast, and my staff committed to thinking different and realized we might fail here, and we need the community to support us in this work.
So I first want to say, when the pandemic started, I was so excited for my organization because we had a crisis plan that included a pandemic. And because of that, we were prepared. We had stockpiles of PPE. We had anything that you could imagine, and I was so proud of us. And I would tell everyone, well, Alvis we've got this handled. However, I did not predict the length of the pandemic. And I'm one of those strategic people that look way out, and I was like, oh my gosh, I'm failing because I didn't look way out. However, like my partners here, our community has been amazing through this process. And like Colin, we've had actually a decent year last year, but a decent year financially is different from a decent year when you're dealing with people. Yeah. The numbers of need, of people with need in our community are outrageous. They're outrageous. Our folks, especially at Alvis, they had so many needs prior to, and we were addressing those needs. We do our programs only based on research, and we were having outcomes out the wazoo. And then all of a sudden it's like, oh my gosh, we still have to continue to do the work, and we still have to have the outcomes, but we have to do it with less. So how do we do that without failing? And so I think that what's been really hard for us, you talked about mental health, and when I talk about that, I have to talk about it a lot because we tried our best to help our staff financially because, one thing I have to pivot just a second, and it's only because of the word nonprofit. I really hate that word. I run a nonprofit, but I hate the word because if we don't make a profit, we're in trouble. Yeah. We're in trouble. So we run our organizations, all of us, like they're businesses, just like any ABC organization out there. And so when I say nonprofit, we have to struggle to make a profit. And people come to us with heart, but also they come to us for a job to make sure that they can sustain their own homes. We were lucky to get dollars to be able to pay our staff $2 per hour extra in hazard pay. And that meant the world. I mean, we were seeing this drop off of staff that was unbelievable. I mean, it was like a mass exodus, but like EC said, we never stopped. Every day we had to do that. But I did want to mention one thing about the pandemic and our one division, which is Amethyst, and the moms who live with their kids. And the moms are in the throes of addiction, and they have never spent all day with their kids, ever. And all of a sudden, their kids were home. They had to help them with their education pieces. They had to provide food. Food insecurities came up just like that. because they weren't used to feeding them every day. They were getting 2 meals a day at school. And so there's just so much to this whole pandemic that a lot of people on the outside don't see. But I have to say that our partners and our nonprofits, we have been amazing to get together and to make sure. And there was another point that someone made about, people in their silos. It's silos, and it's also, I'm gonna make up a word, good lows, because there's these separate organizational things that that are good, but then there's also these things that we don't want people to get so embedded in their own silo that we can't come together. So I think it's been really good for us to be able to come together.
Thank you for those answers and insights, too. We're at 12:32. We're a few minutes away from the first audience question, so start thinking on that. Let me ask one that I don't intend to be quick, but relatively quick, briefly before we get into some bigger pieces. One of the questions I'm getting a lot from folks, and I'm sure you all are as well, is what are the emerging urgent issues you're seeing in terms of need, whether at your agency or others? Again, being 14 months into this, things have evolved a little bit between the emergent needs 14 months ago and now. What are you seeing at your agencies in terms of that piece of it? Denise, if you would kindly go first. Sorry, you were just putting your mask back on.
That's okay. I'm trying to comply with.
Dr. Roberts says we're good.
Emerging needs are always number one is dollars. I mean, I hate to say that because I think everybody thinks that's what's going to come out of our mouth, but it is dollars. We'll have to stop paying hazard pay at the end of June. Pandemic's not going to be over in June. I still have hundreds of staff that have to work one-on-one with our clients every day. And then we also have the staff that do not want to get vaccinated. And we have clients that do not want to get vaccinated, although they're available for everyone. So dollars are always there, but I think that we need more of an infrastructure change. It's like we need a nonprofit infrastructure change because we all had to pivot and change our infrastructures. As for the pandemic, why aren't we doing that globally? So that would be my short answer.
Thank you, Denise. Colin?
So the emerging need isn't so much emerging anymore, but ongoing. We've spent out almost $30,000 in crisis funds from our family center, which was intended for our families, and quickly it needed to be used for our staff as well. Thank you to the Columbus Foundation and United Way for making those funds available to us. That's not a new need, though. It was just, it all hit at once. Instead of, pinch hitting and getting shirts or getting food or getting some housing, that all happened at one time. And I didn't think I'd have to budget for an emergency fund every year, but it's now a new line item in the budget. $5,000 per location to take care of family needs was not something I was anticipating before this. But I have to agree, I think this infrastructure shift, and ironically, we didn't know at the time that we'd be sitting on this panel, but I've reached out to both organizations and said, I'm good at early childhood. That's what I do. I do it very well. I want to think through how we help out here. I have families that I know Alvis is serving. I know that there's work that we can be doing with the clinic. How can I be really good at early childhood, and instead of trying to fight for those dollars to make a program work to get the funding, I'm just going to turn it over and say, here's my partner, here's who I'm going to work with. I can't take on more than I can take on. And I think that goes into a little bit of the systems change that you're talking about, Denise, with what we need to do as a community in terms of, in light of the pandemic.
For me, it's workforce. We keep making these great plans of how we're going to serve people. We need people to do it. Whether it's community health workers, whether it's a social worker, this work is not easy. Leading someone and advocating for them as we know that they need is something very time consuming, and it's for one person. And so I might have a staff that has 30 urgent people on their caseloads, and it's taken them. If I have a pregnant mom that's drug addicted, the resources that we need to provide for her are extensive, and the people hours. It's a huge financial commitment, but it's also a human resource commitment. And so to me, it's the people and it's the wages. You know, I know we're advocating for $15 an hour, but they need more. And so, and as a nonprofit, you're always trying to, again, do this balance of where your pay scale is versus what the work you're asking individuals to do. And it could cause high turnover because of the wages and because of the amount of time that people are engaging with individuals. So for me, when you talk about that shift of the nonprofit infrastructure, the workforce, it takes special people to do this work.
Thank you for those. And the adjustment, the flip side of that is then, what are the bold, systemic things you'd like to see happen yesterday? And one of them, I think, is the infrastructure. And to be clear, she's telling me what to do. That's the Human Service Chamber's charge, so she just gave me homework. But what are some of the bigger systemic pieces? And, you know, one of my frustrations is always when people say, well, Michael, the sector just got all this money. Why are people so hungry? Why are people still homeless? And my frustration is the direct service providers that each of you and your peers are, you're charged with addressing the immediate. You don't have even the authority, the opportunity to change the systemic. But let's pretend for a moment, or more specifically for 3 minutes, that you did. If you could talk to the White House and say, here's what we need. If you could talk to the mayor, here's what we need. What would one big or two big systemic pieces be, whether it's how do we address racism as a public health crisis? How do we build out broadband for the community? How do we create data sharing across sectors? How do we, and those aren't even systemic pieces, those are just consequences of systemic pieces, right? So EC, if you'd be so kind as to take that first, and then we'll open it up to the audience.
So you talked about data sharing. I think it is systemic. The dance that we make people do to fill out applications to qualify for all 12 of our programs, and then they go to Colin, and then they got to fill out paperwork for Colin, and then they go to Denise, and they have to fill out paperwork for her, and then they go to Job and Family Services, and they have to fill out paperwork for them, and then they go to the doctor's office and fill out paperwork for them. 50% of those questions are the same.
Going to the same agency.
Yes, and so that's a workforce burden on my staff, right? Because they got to collect all this information, right? Then there's a delay. So now there's a delay in getting the information because we're all collecting the same thing. Why can't we create some common portal? I know we got to get through HIPAA and all that great stuff, right? But you can call a pizza place and they can tell you what you ordered the last time. Exactly. Why can't we? And I don't know if we need to reach out to those Fortune 500 companies to help us design that system. That would take away half of the work that we have to do. It's just qualifying folks for the services that they need. If I qualify them and then Colin has to help them and all he has to do is go in the system and see that the check mark is checked and all that work is done, we could do wonders with trying to expedite getting services to people, and we could reduce the amount of cost or expense that we're spending on paperwork.
So Michael probably knows that the answer is going to be here, but we now have universal birth to 5 education, while still putting money in and supporting agencies like the two to either side, because you can't, this is the problem that we're doing. We're either saying, how can we reduce racism? How can we reduce the houseless crisis that we have? How do we reduce food insecurity? And we shift all of our funding into the current need right now. And then the current need right now is the current need 5 years from now, and the current need 10 years from now. Because what we're failing to do is stop gapping on the back end and saying we can address some of these things in classrooms, and our classrooms don't start at kindergarten. Honestly, we're putting a lot of our funds into saying our classrooms start at 3rd grade. If we go all the way down to when a lot of these things emerge, if you want to talk about racism, for example, I can spend a lot of time talking about this. I spend a lot of my academic life studying this. Racism develops as a like-me preference right around 18 months. We then see it as the way that we select friends and who we play with and the materials that we use at age 3 and 4. And then by 7, it's an actual prejudice that we're seeing in the classroom. Like, if you want to address racism, let's talk about early childhood. If you want to address food insecurity, let's talk about feeding kids. And I know it sounds like this is the work that I do, of course I'm going to say this, but I'm also saying let's fund it, let's get the system in place, but then let's also make sure we're helping the back end. I don't want a universal program if we're having to not fund food insecurity. We can't keep shifting back and forth between the future and the present. We need to address them both at the same time. And we need to do it in a way that allows nonprofits to do their work and stop putting so many restrictions on what we can and can't use dollars and resources for.
So I will be really quick because I think EC was in my head, because that is really troubling. You know, I'll even get calls where someone will say, Denise, I got one of yours. What do you mean you have one of mine? You are here to provide services for every client that walks through your door. You don't have one of mine just because he has a past or because they have drug issue or a mental health issue. So I do totally believe in that when if you're able to have this universal system to put things in and being able to cross-reference and to also reach out, not reach out to say you have one of mine, but what did you do for that person? And how can you help them further? That's what I would like to hear. So I just want to, piggyback on that because I think that's what's important. I gotta say one more thing, but I do think that a lot of people don't realize how much public policy work we have to do. Yes. We are at that State House right now. It's the budget time. We are fighting for dollars. I mean, but public policy, those kinds of things, Medicaid expansion. I mean, I could go on with the things that we have to fight for in addition to what we're doing. Sorry.
Never apologize for talking about public policy and its importance. I'll take a moment of privilege here to talk about public policy since you gave me the chance to do so, and then we'll take the first question. I promise I won't go too long, Jane. We're at a moment when public policy is imperative, but there's a challenge on alignment across local, state, and federal government. And we've had a complete 180 in terms of the federal government's approach to health and human services prior to January 20th and since, where, for example, the prior administration was trying to take away food stamps from 3.5 million people. That is no longer the case. And there are many, many, many examples of that. But how do we align it at the local, state, and federal level, no matter what the issue is related to health and human services, whether it's a funding issue or it's a resource issue or an access issue? It is imperative, and it affects our sector enormously, enormously. And it isn't political or partisan. We've had great partnerships with Senator Portman on a whole host of issues. In fact, we just endorsed CARA 3.0, and we've had great partnerships with Democratic officials as well. We need to come together and find these solutions that work and pursue them vigorously. Okay. My public policy piece is done. Jane, could you please share the first question from the audience?
I have a number of questions from the people who are watching online, but anyone in the room, please just feel free to line up as well. We'll try to do every other one. If you don't mind, I'll do online, and then we'll do a question from you all. Lori Overmeyer from Gettler Associates. The pandemic has been a time where many nonprofits have added to their collective skill sets. But what are some of the practices and activities you have or will be discarding because you realize they really didn't work?
So one of the things, because everything's virtual now, one of the things we'll be discarding is as many people that can work virtually will work virtually. We have a lot of properties that we don't need because of that, but the practices that we have realized that we should discard is, well, I don't want to say discard because I don't want to totally get rid of it, but what I would say is that we realize that we have to do more for our staff. We have to always continue to do more for our staff. Staff has to be the number one to be able to complete their jobs, number one, but also to be appreciated. And we've done some really unique things like drive-through appreciation days for our staff and sending them kudos and all kinds of different things throughout this process. But I would just say that it's so important to take care of your staff.
So there's a host of HR policies that we had to reshift and rework, and we're going to leave those in the past. The thing that I'm personally going to leave behind, though, that I'm going to discard is this assumption that we have to make sacrifices, particularly with our people. I can't discard a classroom and still be early childhood. I can't get rid of books and still be a school, right? That's not a thing that I can do. What I can do, though, is discard this idea that it's okay to make less than $11 an hour and ask someone to do the most daunting work. I can put aside some HR policies that are antiquated and update them so that policies that we have then match what's happening in the for-profit sector. Because the reality is, I'm not competing with the nonprofit human services sector for employees. I'm competing with Columbus's booming economy. I'm competing with all the workforce that's coming in. I want top talent in my program, which means I have to compete with Nationwide and I have to compete with Huntington Bank for folks that are top talent. And in order to do that, we have to shift a little bit about how we care for our staff.
So operationally, we had to make some changes at our actual clinics so that we could see patients during the pandemic, and we didn't know that they made us pretty efficient. And so we actually reduced the number of volunteer doctors, which is interesting because we were in this recruiting frenzy to say we don't have enough doctors. But the way that we reorganized ourselves so that we could see patients, we need less doctors and we can still see the same amount of patients. And so we've definitely gained some efficiencies from making those changes, and we're going to keep them. And we're going to do away with our previous enrollment process where we had people come to the clinic and they had to fill out all their paperwork there. We can help them fill out that paperwork beforehand, and it takes a lot of time out of the process, and it also allows us to assess them before they get to the clinic to better serve them with some of the other social things that they're dealing with. So we're not waiting for them to fill out the application there. So we won't do that anymore as well.
First off, let me just say, EC, I'm so glad you brought up about the paperwork that we force clients to go through from agency to agency. It's just inhumane. And believe me, as a nonprofit CEO, we do follow all HIPAA things. I've never had the HIPAA please visit me, so well, I may now, but that's
Introduce yourself.
who to look for? My name's Steve Voltaw. I'm with I'm Dwayne Casares. I'm with Directions for Youth and I'm with Directions for Youth and Families. We're talking about the state of nonprofits and really in response to the pandemic of COVID, but I have believed, many of us have believed from the beginning, there's really two pandemics here. Racism and social injustice is a whole nother layer that has been added on top of all the struggles that the COVID pandemic has brought. So can you each speak a little bit about what layer that has added, not only to your staff, but also to the people that we serve?
I'll start this time. So two really interesting things happened over the wake of the past year. The first was an internal debate about, as a preschool, do you put out a statement affirming what we all know is true, which is that Black Lives Matter? The fact that I even had to have that conversation was insane to me, and I was just going to put one out anyway and didn't realize that that was something that people would have thought we should have a conversation about. And then from there was a conversation around, so if you've never been to the South Side, I would say 70% of my staff are women of color. The conversation then became, there is a new requirement from a policy from a funder that requires training around anti-racism, anti-bias. One of my teachers asked, who's deciding what that looks like? Who's going to be the person that's teaching me that? Because as a Black woman living in the South Side making poverty wages, I live this every day and I will not sit through that training. And I said, you know what? You are correct and I will not make you. Because they live this every day. We have to acknowledge who we're serving and how we're serving. The other thing that we're spending a lot of time on right now, and I think it's a good use of resources, maybe others would disagree. I have 2 policy fellows right now going back to public policy. Things like work requirements to get access to publicly funded childcare is inherently racist to some extent. We need to think about how we can shift some of these policies that have these built-in systemic lingerings of things like redlining and the reason that those policies came to be. There had to be a cut. The easiest way to delineate a line is to put an income restriction on it and then say all adults in the house have to be working. That's going to get rid of a very specific and targeted population. And we need to acknowledge that, and we need to address that full on. And I'm excited that we're putting some energy and some bodies on that work, because those things need to change. We can't address racism unless we're willing to acknowledge that racism exists at every level of the work that we're doing. And it reminds me of a time that we had a tour come through and they commented on our books. We have a really diverse library at Southside, and they asked if it was for Black History Month. And I remember having to go to the teachers in that room and apologize on behalf, I should have said something in that moment. It was wrong of me not to. I didn't honestly know how to handle that, because that's not Black History Month book. That is what my library looks like all the time. And it's actually funny to me that someone even pointed it out, because it was across the 9 rooms that we went into. Why was it that one classroom that you acknowledged that was something different?
So my staff really looks like who we serve. Including, we have a large immigrant population that we're serving, and I know that hasn't been brought into the conversation yet. And so one of the things during the pandemic that we found really difficult is the information that was coming out was in English. And so even the hotlines that you were calling at first, they were in English. And many of my staff who speak different languages were calling the hotlines with patients and clients to interpret some of the information because it wasn't getting to them in a way that they could understand. I think the other thing that we have to look at some of our policies is, I work with community health workers, and I'm always complaining about the benefits cliff. I want to give people raises, but I may not be able to accommodate what they're going to lose in their current benefit package. And so that's something that we need to look at, because it's not that people don't want to work, it's that the difference in there's no ease of acclimating them into the community, acclimating them into that new wage so that they're able to adjust whatever it is that they need to adjust. So, I'm the one asking my staff, can I give you a raise? What is this going to mean for the benefits that you actually are getting? And then make the decision of, okay, give the raise or try to do something differently. So some of those things are actually, built into thinking of how do I address some of those problems or policies with my patients. But with the immigrant population, there's also fears of service. I know that at one point there was this big thing with ICE, and so we easily saw where our Latino population wasn't coming to the clinic, and we were wondering what was going on, and when we checked around a few other places, it was happening there as well. And so some of the messaging that comes out is, they're part of our community, and so if we're all one, we've got to help and we've got to assist everyone. So I think that also looking at the immigrant populations and other people of color in our community also is something that we're looking at and how we are working together.
I'll be really quick, and I think I started this by saying I was having a really hard time this morning. And I was having a really hard time because of probably what you're asking, Dwayne. And, I'm tired. I'm tired. Our staff are tired. Our clients are tired. It's affecting everyone all over the place. And I'm really tired. I have a 24-year-old college student. And I fear when he walks out the door and gets in his car. I have that fear, and everyone that works for me has that same fear. I was really, really happy, though, when our organization entered into an agreement with a facilitator for 18-month DE&I exercise. And this was way before the social justice issues last summer. And it was 18 months before that, actually, but we had to stop because of COVID. But so many things have come to light, and we have an internal DEI council that has really delved deeply into the things that you're asking. But I just want to say I'm tired. I'm tired, and I think a lot of people are just tired.
So we have quite a few questions, and I'm going to apologize to everyone who submitted a question. I know we're running out of time. So I'm going to end with a question that Michael will love. Mimi Dane asked, how can we as community fund the Human Services Chamber so that it can grow its staff to help our nonprofits? Is that a softball or what?
That's an easy answer. That's very generous, but I want I want anyone that might want to fund us to fund our agencies instead. And listening to the three of them, you understand why that is the case. So thank you to whomever asked that question, but thank you, but no. Please give it to my bosses and their agencies. I think we could have this conversation all day, and Dwayne, who is also one of my bosses and runs Directions for Youth and Families and one of my friends, I'm grateful for you asking that question. I'm grateful for the answers that you each shared with us. I don't know how to close after that, aside from saying, I'll share a quick anecdote. A few months back, so I email our CEOs once a day with information and stuff and thoughts. They're sick of me. They're really sick of me. And once, yeah. And I told them a story about a college professor of mine after something harrowing had happened in the community. He was a legendary civil rights professor. And this was years after I graduated from college. We were talking about a young black man that had been killed in the community back in 2012. And he said to me, at some point, we're going to wreck the status quo with a wrecking ball. And I think we have this opportunity as we come out of the pandemic and as we are at this inflection point to really think differently about how we approach things, including and especially one another. I'm grateful to each of you. Can we all give them a round of applause, please?
Excellent. Well, I hope you enjoyed today's forum. It's a sobering forum, to say the least, but there is a light there. And earlier, I asked you to go to columbusmetroclub.org and become a member, donate. Pick a nonprofit right now and commit and give some of your time, give some of your money. We're all pretty fortunate to be sitting in this room, so we can do a little bit for those organizations that are helping our community be better. So don't miss the premiere next week of a new CMC series, Exploring Neighborhoods, hosted by the Dispatch Opinion and Community Engagement Editor, Amelia Robinson. This first edition will feature Reynoldsburg, with many more Central Ohio communities to come. Thanks to the Emergency Response Fund of the Columbus Foundation for presenting our live stream in partnership with the Columbus Dispatch and PNC. And thank you to our sponsors, the Crane Group, the Columbus Foundation, and Grange Insurance. And thanks again to our virtual online seat patrons. Special appreciation to our speakers. We could not do this without you. Denise Robinson, Colin McGinnis, Ikharebha Green, and Michael Corey. We hope to see you again next week. Until then, be well and stay safe. Thank you.